Megan Fox has the story.
Megan Fox.
Megan Fox.
Megan Fox.
Megan Fox.
Megan Fox, a national journalist.
Mastodon. I will never be able to say that.
It feels like the Flintstones live there.
It does.
Well, don't trust women. I think you just touched on that with your last. That's what they brought. We're going to have to bring back chaperones.
Jesus, no.
Just careful. Stop! Break! Ooh. Hard right.
How did you screw up a stove, Megan? You're a woman. I thought that was baked into you. Like at the genetic level, how to operate kitchen equipment.
And honestly, Megan, if you don't like it, I'm sorry. I've been very nice to you.
You get Dino hanging out outside chewing on a large bone. I highly recommend being targeted by the New York Times and Rolling Stone for weight loss. And I'd say, keep it coming. I need to lose 20 more. Please, keep it coming.
Explain to me, Megan, why did this country not have a holiday once a year? That's the time you vote. If you don't show up and vote, up your ass. You don't get another chance. You don't get, I don't care if you're in the hospital. Crawl to the stake, crawl there. But that's it, 1 day, 12 hours, and then you're done. And you count them that day, and that night you know who the hell won.
I will eat you alive. You want to tangle? You want to go?
The only thing going through my head is, what are you going to do when Megan Fox runs wild on you, brother?
He made a deal with the devil. She's the devil.
He wants that.
Oh, God. Gross! Oh! All right, penalty box for Slug. Yep.
Of a mile.
Are you ready to behave yourself now, Slug?
This frustrating rep.
Are you ready to behave yourself? Repossessed puppies? I'm hiding Pork Chop! Have you seen his little pork chop? Oh my God, Pork Chop is the cutest.
That sounds bad.
Have you seen it?
Pork is pork!
Though you may be tempted, do not contact any person or persons mentioned on this stream. Do not even think about contacting anyone who may be the topic of the daily news. If you should do that, the host will question your IQ, possibly call you names, and mock you for disobeying these basic rules of decency.
All the best.
Good morning, everyone. Welcome back to the Timms trial coverage. Thanks for letting us have a day off yesterday. I had a headache. I didn't feel good. And neither did Flux. And look, now she has a cold.
I feel better than I did yesterday, but I feel like I sound sick. I don't know if I sound sick to you guys, but I can hear it.
I can hear the stuffed upness. We have mom hearing, so we're like, okay, I'm gonna need you to get some Vicks Vapor Rub
and vitamin C. Okay.
Yeah, Megan's gonna be the one to give you all like the homemade remedies. I'm gonna be like, have you ever tried a hot toddy?
See, I did. I was talking with Connor yesterday, and he's like, get the hot tea and honey. And I'm like, oh, local honey in your tea. But I also was at Walmart yesterday because I had to go grocery shopping. And I picked up that emergency, that like powdered stuff.
Yeah, the liquid stuff.
That stuff. No, it's a powder.
Oh, I thought it was. Yeah, you put it in the liquid, though. You make it liquid.
Yeah.
That's what I meant.
You just snort it up your nose.
Too.
That's
Comes
for
with
people
a straw.
That's for people with a past, Mo. That's oh, so
try that way. Maybe maybe it'll work faster.
Yeah, maybe. Jennifer Williams is here too, and she is off camera because she's somewhere else today, but she will be here commenting when she can. I have updated the bingo card. I guess we should take a look at it. Let's take a look at the bingo card, everyone. Share screen. Why do I have to say it out loud when I do this? But I do. I have to say it out loud. Share screen, add to screen.
I know. I talk to... You should see me doing Canva with thumbnails. I'm like, no, move over. The over.
When is AI going to start responding to voice commands, you know? All right, we've got State Badgers witness, rude, making shit up, witness bonds with jury, objection, state repeats objection, mic drop judge, C-word, witness makes the state look stupid, Spider-Man meme, cork on the fork, hearsay free space, what do you do here? Questionable certification, chat contempt, unknown significance, judge has a Werther's break, what a bitch, double salute, nothing burger, everyone gets angry, reading glasses, panel cheats, overruled, oh shoot, I hit the wrong button and now I don't know what are the other ones. Damn it.
Megan hit wrong button.
Megan hits wrong button. You can go ahead and check that off now. TikTok, nothing burger, boom roasted, reading glasses. I think I said these. Thug judge, witness makes state look stupid. I did. Damn. Witness, we got that one. Irrefutable proof. State's doctors are paste eaters. Brassy locks, Kahunti behavior. Hair talk. Megan hits wrong button. Objection. Hearsay sustained, overruled. What do you do here? Which citing? What a bitch. Flux is going to get angry. Get squunched. River dancing. We did Spider-Man meme. Do you have a question? Angry Swede. Chat breaks panel. Megan's blood pressure is over the roof. Sidebar. Questionable certification. State repeats objection. Cork on the fork. Circle squunch. Chat contempt. Rude. Judge has a Werther's break. I already said that. Shut up. Simulation does not disappoint. Chat hates prosecutor. Panel hates prosecutor. Unknown significance. Everyone gets angry. 15 minutes of obligatory bullshit. Squirrel. USA. Dumb man proud. Panel cheats. Fake words. Muted boomer. Bitch slap. Double salute. Prosecutor is a paste eater.
Yes.
Okay. I got through it all.
You can tell the ADHD is strong with us because we're always adding new words.
And it's a struggle to get through it the more and more we add.
All right, so this is mine. This is my bingo card. Do I have Megan hits wrong button on here? No, I don't. I'm just going with one today. So I will keep track of what we have already discussed. All right.
Oh, I changed my avatar. What do you think?
What is it? Wait, I can't. Hold on. I have to make you bigger.
What do you think?
I love it. That was a great show, by the way. That was a really good show. Wait. I have to do something. Keep your avatar up.
Okay.
There we go. That's what you needed.
Yes.
Oh,
Okay.
We should have put sombrero on the bingo card, and we could all be checking that off now.
That is great.
I am from SoCal. That is fair. I am from SoCal.
You guys, so when I had to go look for my river dancing dress, I may have found the perfect things for Dr. Messner. I just don't know how to get them to him. They're a pair of Tina glasses from Bob's Burgers, but I think it would be much funnier if he had to do his affectations with the Bob's Burgers glasses from Tina. I'm just saying.
I agree.
So they were $1,
Those are
so I had to
awesome.
pick them up.
I agree. Those are
My
fun.
husband's like, what do those go with? I was like, nothing. I'm going to use them to make fun of someone.
I'm going to use them for internet mockery. You know,
Yes.
the usual.
Like 90% of my wigs.
Internet bullying, you know, it's just a thing.
Yes.
I love it when grown-ass adults accuse us of bullying them. Like,
Well, I
Really?
mean, considering
It's
my
just
next
called
roast
mocking
is
an
of
adult
Donna
thing.
Adelson, I don't really give a flying flip.
I'm the only one on earth who didn't pay attention to that trial. I swear to God, I feel so lost because all of my friends have paid attention to the Adelson trial and I haven't. What the hell just happened?
Wait,
No!
did you finally get the mystery
Not
of what
the
happened to
pig
the
nipple
nipples?
guy.
No, not the pig nipple guy.
We don't
Why
want
did this
the nipples.
happen? No, stop.
Not with the salmonella on his arms.
What even just happened? There we go. Chicken cage match. That is the wrong video. What the? While you were sleeping, YouTube is broken.
Good movie.
What?
No, I guess we
love
could
that
watch
movie.
it. You know, I mean, I guess we could. But YouTube is
They're
broken.
going to copyright strike us.
YouTube is fucking broken.
What in the world?
I think it's telling us to watch that movie later.
Dr. Hutchison, can you
Maybe.
hear me?
All right, I think I'm just going to try not to touch YouTube again.
Hold on 1 second. Let me help me out. Just hold on.
Oh, the witness cannot hear.
I'm not touching anything. We know what happens.
We left off where Catherine Bernard was going to be doing the redirect on Dr. Hutchison.
How about now? Can you hear me, doctor?
I feel more like your voice is just echoing through some microphone somewhere in the courtroom rather than being your actual microphone. Because when you're close or far, it's about the same.
Oh, God.
Maybe tap it and see if it's
I
working.
love court technical issues.
Your Honor, if it's a
Court audio is so fun, isn't it?
real issue, I'll be glad to close out my material, move to the side, and give her my
They
mic
really
since
should
it
have a
worked well.
Brad
Or I
IT
can-
goatee on call.
They do. We're skipping through this.
If you'll push it this way towards her.
Oh no.
I think
She's
I'll
such a
be okay.
pleasant-looking woman. I'm just gonna throw that out there. She's a very pleasant-looking lady.
All right, and good afternoon, Dr. Hutchison. I believe the last question that the state asked you.
All right, chat, I'm going to give it to you. The court has a boomer moment. We could probably check off muted boomer.
Was whether or not you
Court
could
mic
exclude
drop
child abuse in the case of Jameson Timms. What are the kinds of things that you look for when determining whether fractures are in fact a case of child abuse or non-accidental injury?
I mean, that's a really humongous question. That's like fractures from head to toe.
Well, I suppose, what would you tell your pediatricians if they were trying to figure out if this was abuse or something else?
I think, as I said before, I would have suggested that we get a better look at those fractures to date them better because they looked like they were very far advanced in the stage of healing. And that would have made me worried that perhaps we missed them previously when they were there, even though that would be unlikely, but it's still possible. And anytime we're possibly going to end up in court, which is like we are today, I would suggest that we get a better look at those with chest CT if possible to better date those. And then the question about the spine, if that was a question, then we could have figured that out with other imaging as well.
Given the fact that that additional imaging was not done in this case, is there anything else we can find about the results that we do have from Jameson that can tell you whether or not this was an inflicted injury?
Well, I'm not sure exactly what you mean, but everything has to be correlated with the full clinical picture, like if he was a premature baby, if the mom had anything that she may have, any family issues, inherited issues, taking any medication, if there was abnormalities in the blood work. I mean, all that stuff would be taken into consideration. And looking at the ophthalmology exam to see if there are any bleeding in the eyes or any bleeding in the head, those all would be taken as things that would be going for or against, or as additional evidence that could potentially indicate inflicted versus accidental injury or possible other process going on with the bones, genetic workup, all those things.
And you did review the head CT scans that were done of Jameson in January of 2022, right?
Yes, ma'am.
And did they show any bleeding behind the brain or the eyes?
They did not show any bleeding, and the eye exam, we wouldn't see the bleeding in the eyes, generally speaking, with imaging very well unless it was really severe, but I know that there was an ophthalmology exam done at one point early on that was normal.
So would you expect that to be normal in the case of a child who had inflicted trauma?
It may or may not be normal. It's always good to check the eyes because if they're abnormal, that is really, really strong evidence for child abuse if they're abnormal. So generally checking the eyes is part of the routine workup.
And in terms of clinical observations of Jameson when he was brought in in January of 2022, are there any signs that you would tell your pediatricians to look for when they were examining Jameson?
Well, my pediatricians generally know how to do a physical exam, so I don't really advise them on that. That's more of what they're going to be doing. I'm more helping them with working out what's happening on the x-rays and how that might relate to the patient.
Would you ever be able to see soft tissue damage on an x-ray?
You can occasionally, but it would be better seen with MRI, and obviously their physical exam is important for that.
I did not know you could see soft tissue
Would you
on
agree
an
that
x-ray.
Jameson scans do not?
So they said sometimes, but like she said, like it's easier to see it on an MRI.
Yeah, that's interesting.
I believe that the one radiologist for the hospital said that in severe cases you can see severe tissue damage on an X-ray, but not minor.
Not show any evidence of soft tissue injury?
Yes, I would agree.
And you mentioned earlier that compression fractures are very rare, and particularly in infants, if I understood you correctly?
Yes.
And can you tell us a little bit about why you believe that to be the case?
Well, after 30 years, I've only seen a couple of compression fractures. Both of them were very subtle and required additional imaging to be certain.
And did they exist in conjunction with other injuries, or was it just the compression fracture?
No, they existed with other injuries.
Would there be any way for the amount of force necessary to cause a compression injury to be inflicted upon an infant of Jameson's age and not cause significant other injuries?
Your Honor, I'm going to object. I think that's outside her scope as a radiologist. That would probably be better suited for a child abuse specialist.
Oh, God.
And
Nothing is ever suited for us.
The witness has previously testified to her specialized training in child abuse. She's actually written chapters.
Yeah, she does have specialized training in child abuse, yo-ho. All right, let's check off objection.
Yeah, yo-ho.
Yo-ho.
Can we do cork on a fork? Because honestly, they knew it, but she went through her CV with her. So she's like, oh, and I've done this and I've got paperwork from that. And I wrote the book on, radiological findings of like CA.
Right. But somehow she's not.
Was that the square we forgot? The prosecutor eats paste.
No, I put that in. That one's in.
Okay.
The prosecutor's a paste eater. That one's in there.
And textbooks on it.
She's written textbooks on it, Your Honor.
Specialization, then I think she can indicate that, but I don't think it is outside what she has been qualified for, Your Honor.
I would overrule the objection. I'll let her answer the question.
Overruled.
And again, based on your experience, training, and research, is that something that you would be able to determine or have an opinion on, whether or not that compression fracture and the small rib fractures that you observed in the healing stage, whether that's something that could be caused without other injuries?
That was a really big question about a lot of stuff. I'm going to try to answer that. I guess the best answer is that nobody can really take babies and squeeze them and do serial x-rays and
get squunched
scientific pressures to their chest to see how much force it takes. We can't take babies and slam them down on their butts over and over and then see when we can see fractures.
Right.
So
that would be
that's
bad.
really an unanswerable question, but I can just tell you that rib fractures are commonly seen in babies with child abuse or accidental trauma, and compression fractures are rare. So that, especially compression fractures, very rare, usually are seen in a setting where there are multiple other fractures in a very severe case of abuse, at least in the cases that I've seen.
Well, and Doctor, if we could talk a little bit about your specific experience in the field of child abuse. I believe you testified earlier in speaking with Mr. Hood that you had been involved in presenting specifically on the question of child abuse. Is that right?
If you're talking about my papers and presentations nationally and internationally, I have. But if you're talking about in court, I have testified on behalf of plaintiff the majority of the time in the criminal, family, and military court for the Air Force and the Army.
So, and how would you estimate the divide on when you are testifying for the prosecution versus when you are testifying for the defense?
The vast majority is for the prosecution.
So is it safe to say that there are many cases in which you have found evidence of non-accidental injury or inflicted child abuse?
Oh, yes, definitely.
And did you find those indications here in the case of Jameson Timms?
I found mostly healed rib fractures, and then there was a question of something in the spine that I did not think was sufficient to call. So in that situation, I would not have felt like that was adequate evidence to say that it was imaging-wise, definitely child abuse, and I would have advised them to continue to work that up and see if they could get more information so that we could make a more definite decision.
And if you had found evidence suggesting that this was inflicted or non-accidental trauma on Jameson, would that have been the medical opinion that you offered?
Yeah, absolutely. I look objectively at the imaging findings.
And you are being paid hourly by the Timms family for your services in this case, correct?
Yes, ma'am. Anytime I'm in court, whether it's on behalf of the plaintiff, and if I've actually read the imaging, I just take a day off work, I'm still being paid to be at work, but I would be in court. And in a situation like this where I'm on a vacation day, then I may be paid by an outside source. So I'm not, in my regular, for many years, like, if I'm working in a hospital where I'm an employee, they just say, go to court instead of coming to work today. But either way, I'm getting paid, whereas in this situation, I'm on vacation, so I'm getting paid by the plaintiff. Or, yes, the family.
But just to be clear, you are offering your honest medical opinion and based on your professional review of the facts that have been presented to you, right?
Yes, ma'am.
Approximately how many times have you testified on these kinds of issues in court?
Over 30 years, it's really hard to be sure. I'm sorry, I couldn't really tell you for sure because, most of the time things don't go to court, but, and so I've talked to attorneys and on both sides and law enforcement many times that it didn't even go to court. So, but as far as going to court, it's hard to be sure. It could be like 20. I don't know. I'd have to go, I'm not sure.
And so have you observed or learned about through your research any connections between medications taken by the mother during pregnancy and the likelihood of fractures or issues in young infants?
I'm aware that there are some medications that may have issues related to bone health, but I do not think I would be the person who would be qualified to testify on that any further.
Certainly. And in the course of your practice, have you ever made any other observations regarding connections between the circumstances of pregnancy and birth and the likelihood of bone fragility or early in life fractures?
I'm not sure really how to answer that question, except that if when you're looking at a child that's very young and very close to the time of birth, birth injury would be something you would always include in your differential, and then you would just weigh the possible differential diagnoses. But you wouldn't look at birth injury in a 2-year-old, for example.
But you would in a 5 to 6 week old or a 3-month-old?
Yes, that would be, I think that, up to 3 months, you would definitely want to consider possibility of a birth issue.
And from what you have observed regarding the stage of Jameson's healing fractures, you cannot exclude birth injury as a cause of those healing rib fractures.
I cannot, no, not with 100% certainty, I cannot.
Would the physical size of the mother delivering the child have anything to do with the likelihood of birth-related fractures?
I don't think I'm really qualified. I don't think that I know any specific answer to that question. I'm not really involved with the deliveries of babies personally. I'm aware there's some literature on that, but I couldn't quote that or answer that specifically.
Are you familiar with medical literature relating to the Swedish fracture registry?
I'm aware that there is a fracture registry of about 1.8 million babies that have had birth-related fractures from Sweden. I'm aware of that, yes.
And have you had occasion to review any of that literature?
Your Honor, I'm going to object if I haven't been served the literature she's referring to.
Let me let her finish your question. Let's see if you've been served with the literature.
And I was not referring to any particular piece of literature. The Swedish Fracture Registry is a research function that has been undertaken by a group of doctors. And so I'm merely asking for her familiarity with it and whether it has informed her own research and conclusions.
I'll let her ask that question. Go ahead.
And have there been any conclusions that you have drawn in your own research or conclusions from that database of 1.8 million infants with fractures?
Well, my job as a pediatric radiologist and also as a physician is to pay attention to literature as it's accumulated throughout my career. So as that is part of the general body of literature, I'm aware of that study, and it has confirmed many of the things we already knew about which fractures were most common, but it has also raised a lot of questions about diagnosing rib fractures as they relate to child abuse in very young infants who are close to the time of birth.
Would it be fair to say that one of those questions raised is whether or not rib fractures are misdiagnosed as child abuse in very young infants?
That is one of the issues that they have raised in multiple papers out of that part of the world, that they're concerned about an overdiagnosis of child abuse in very young infants.
And were there any aspects of Jameson's case that made you concerned about the possibility of misdiagnosis of non-accidental injury?
Well, my goal is to get my pediatricians to a point where they are as certain as they can possibly be about every case. And so in that regard, when I see a healing fracture that's well advanced and possibly could be related to birth, that's why I would suggest additional imaging. The same thing with compression fracture that looks really subtle or suggestive. I would then suggest more imaging, because it's really important for us to do everything we can possibly do at the time of the initial presentation to be 100% certain, so that we don't have to wonder which, if we did everything. We can know, so my goal as the assisting radiologist is to get them to the most certain point that they can be at based on the imaging. So that's my goal.
And you don't believe that based on the imaging that was done on Jameson, that you or your pediatricians would be in a place to make any diagnosis with certainty about the source of those fractures?
Your Honor, that was a common question. I'm going to object to what her pediatricians would do. That's speculation as to them. She could certainly answer as to what she would do.
I'll let you rephrase the question, Ms. Bernard. I was the same.
Certainly. So, do you believe that the imaging and testing that was done on Jameson Timms was adequate to support a conclusion of non-accidental injury?
I don't, I would not feel comfortable, and then with that, I would have recommended additional imaging to get to that point.
And did you find any evidence of swelling or other bone damage on any of Jameson's scans other than what we have already talked about?
I think we've talked about everything, all my opinions.
And so are there any limitations on your opinion that you have offered to the ladies and gentlemen of the jury today?
Not that I can, not on my opinions, no.
Okay. And what is your role in this case? Are you an advocate for a particular side?
I do a blind review and I give the attorney what I see on the images. Honestly, a lot of times I don't even know if the person has called me and claiming for defense. I don't even want to know, frankly, because I think of myself like an umpire at a baseball game. There's two teams playing, but I'm not on either team, so I'm just going to give them what I see on the images, and they may or may not find that useful.
Okay. Would there be any treatment available for an infant with fractured ribs or a compression fracture?
I'm sorry, I missed the first part of your question.
Would there be any treatment available for a child with...
Normally rib fractures are never treated. If there's a compression fracture, sometimes they have to put the baby in a cast or a splint or something. But because oftentimes people with fractures in their spine are generally symptomatic. But I'm not a pediatric orthopedic surgeon who treats babies with fractures, so I would probably defer anything further to somebody else.
Well, if I could just ask you, when you say normally a compression fracture would be symptomatic, what do you mean by that?
Well, a fracture in your spine is pretty severe. Usually it's from a significant trauma, which is why we usually end up doing an MRI and things like that to look at it more carefully. But and this is such a rare thing in babies. And since I'm not actually seeing the babies, I couldn't tell you what their symptoms are. So, but generally speaking, I guess maybe that doesn't make sense that I said that, because if you're an adult, you can say, "Hey, my back hurts," but babies can't do that. So, maybe symptomatic from the perspective of having. Touching them there and it hurts, or they cry. But again, I'm not examining the babies, so probably stay away from saying anything further on that.
But if I understood you correctly, you would expect that if there was an actual compression fracture, that there would at the least be pain and sensitivity?
Again, I'm going to defer any answers on the symptoms to people who take and treat those babies.
And did you give a lecture at the American Academy of Pediatrics on the pitfalls of neuroimaging of child abuse cases?
I hope you're reading from my CV, because I think I did, but I have to pull it up and look at it to be certain what the topic was.
Well, I was wondering if you recalled any of those pitfalls specifically.
Well, those would mostly relate to the brain, so they wouldn't really be relevant in this case. That specific lecture you asked me about was brain stuff.
But you did review the head CT scans that were performed on Jameson in January of 2022, right?
Yes, ma'am.
And you did not note any irregularities or anything that would suggest that there was an injury inflicted on the child?
There was no evidence of head injury, no.
Thank you very much. I believe those are all of my questions. Unless there was anything else that you noticed in your review of Jameson Timms' case that we have not explored yet.
No, ma'am.
Thank you very much for your perspective, Dr. Hutchison.
Thank you, Ms. Bernard. Mr. Hood, any questions of redirect on this witness?
I have one question, doctor. You've been practicing medicine now for how many years?
About 30.
Are orthopedic surgeons qualified to read and interpret x-ray images?
Well, they are not radiologists, meaning that's not what they went to school for, but they certainly look at an x-ray like with just about every patient they see. So they definitely spend a lot of time looking at x-rays, and I know that it is part of their training, but I couldn't answer specifically regarding the training of orthopedic surgeons, as I've been a program director for radiologists, but not for orthopedic surgeons.
Let me ask you another.
That's a good answer.
Is it common practice in your experience for orthopedic surgeons to read and interpret x-ray images?
That's even a better
Yes,
question.
it's very common. In fact, a lot of times they just read their own images and don't even ask us to read them. So that is one specialty that does a lot of their own interpretation.
It's not a hobby, is it?
Well, I guess they're,
No, Jason!
they're billing for it, so I was part of their practice as far as I know.
Thank you.
But you can ask them about that. I don't know. I mean, because once you
not a
bill for it,
hobby.
you're taking the medical legal risk, putting out a report, and you will be held responsible for that report later. So if they're doing it as part of their practice and billing for it, they're taking that medical legal risk just like I would.
Okay, thank you.
Ms. Fox, any other questions of this witness?
No, ma'am.
Ms. Bernard, any other questions?
I guess just one, you mentioned the medical and legal risk of attaching your name as a board certified and licensed surgeon to any opinion that you are offering, right?
Well, if you put out a report and bill, insurance and Medicare or whoever, then you are taking that medical legal risk. That's part of what we do.
Might that be a factor in when a particular doctor wants to swear to having made a specific diagnosis?
Well, in court, we're often talking about other people's reports, but I was just talking about in your daily practice, all day long, I read thousands of x-rays every year, and I take that legal risk thousands of times over, and sometimes, an orthopedic surgeon might do the same thing. Instead of having me read it, because they feel qualified to do it themselves, they just bill for it themselves. So if they're doing that, then they are taking the medical legal risk the same as I would. That was my attempt to explain that.
And you are confident in the opinion that you have offered as an expert here, which is, and then let me make sure that I get it correct, that there was not enough imaging done for you to agree with any diagnosis of non-accidental injury for Jameson Timms, correct?
I would be concerned that we could have done more to figure that out with a higher level of confidence and accuracy.
And that you did not see any other signs of child abuse, such as the brain or eye conditions that might commonly be associated with inflicting force upon a tiny child.
Correct.
Thank you very much, Doctor. No further questions.
Anything else? Mr. Hood? Ms. Fox?
Based on Ms. Bernard's questions, I do have an additional one.
Oh, of course you do.
Dr. Hutchison, the way that Ms. Bernard phrased the question, I'm not limiting it just to the x-rays. If you had hypothetically additional information, the child had a tear very close to the frenulum in his mouth.
Oh, I hate this
He
one.
had a
Frenulum adjacent.
almost was like a carpet
Frenulum
sized
adjacent. Shit, that's not on the
scratch
bingo
his
card.
cheek, on the fleshy part of his cheek. You would look at the other evidence.
All right, panel hates prosecutor. I can't. The hate boner is real.
We almost got out of this with her not asking an additional dumbass
know.
question. It was like going to be Christmas in October. And then, Miss Bernard asks a cogent question. So she comes in like, I have something to say.
Panel hates prosecutors going on there.
She
Does
should
the
be made
chat
to
hate
wear
her
these
too?
glasses when
Does
she
the
says
chat-
those things.
Does chat hate her too? Come on, chat. I want this, but I want to.
Can you guys imagine wanting to prosecute an innocent family so bad that even with all the evidence you hear, you ask questions like that because you're just trying to push your agenda so hard? That's crazy.
Well, I'm also calling her out on being the medical expert because her kids have, osteogenesis imperfecta, but she couldn't diagnose a case of impetigo as supermom. Because I've had 6 kids. That's what impetigo looks like. It wasn't a scratch. It wasn't a forceful tear. It's that cruddy, gross stuff that kids get because their snot stays on their skin.
Right. All right. The chat hates the prosecutor too. So Chekhov panel hates prosecutor and chat hates prosecutor. And I don't know. I'm going for Brassy Locks Cahunty behavior. I don't like her. Or what a bitch. I don't know. Which one do you think?
Both of them.
Both.
All right. Just do both. What a bitch. Brassy Locks Cahunty behavior. We have no tolerance for her anymore.
2 things can be true at the same time.
Before you make
You like my
a call
coffee
as to
mug?
whether or not it is child
Yes.
abuse, you look at the X-rays alone. Isn't that correct?
Yes.
It's a gift from no mom.
Just to be to look only at the X-rays.
Well, when you see a mug like that, you have to get it.
It's one of my favorite mugs.
Oh, good.
So I wouldn't be making comments about the skin or the.
Jim, we don't like her. She
So
can't
you
sit with
can't
us.
sit here today and say the child was not abused because you don't have all the facts that you would need to make that determination. Isn't that correct?
My job is to say whether I think it's abuse based on the X-ray findings, and that's what I'm here to testify about today.
And you're allowed to say that, but you've got to answer my question. Yes.
Oh my God,
And
what
my
a
question is,
bitch.
you do not have all.
What a bitch. We already checked that off. Damn it.
Wait, you can
rude.
answer that question,
Rude.
but I need you to answer my question.
No, she just did answer your question.
She answered it in the way she's going to answer it.
Yeah, and you're not gonna. This
hate
doctor
bitch.
understands that anything she says legally needs to be very careful and precise. So she's using, lawyer speak because she's like, look, in this case, I only looked at these things. And she's like, okay, you can say that you only looked at this, but like if you're a real doctor and not just a hobbyist, like then you would know these things.
All right, I'm going for Flux is angry and double salute. Double
Yes.
salute. Yes. God, I hate this woman. I hate every
know.
sound coming out of her mouth.
How can you be such a bitch all the time?
It's hard.
Is that not difficult?
I think we can check off everyone gets angry.
Look,
Everyone gets
even her
angry.
sea monkeys
Double
hate her.
salute. The sea monkeys.
Look, she can't have a cat. Cats would hate her. She had to go down to a goldfish. That didn't work out.
No, but then she got a snake. Does the snake tolerate her?
Pretty much. They're both cold-blooded.
Child abuse in this case.
And Your Honor, I will interpose an objection at this point.
Objection!
Since the prosecutor has misstated the evidence that was available at CHOA regarding the alleged frenulum tear. Of course, the medical records reflect that the frenulum was intact and the child abuse
There we go.
pediatrician declined to take a photograph of this alleged injury.
Your Honor, I have not stated, please just correct, I said it was a tear under the tongue near the frenulum. That is what the medical evidence was.
Well, let me say this. And as to the 2 attorneys that are discussing it, the witness has already stated that, and these are my words, not the witness's words, the witness has stated that her area of expertise was in reading the x-rays and that she would not be qualified nor comfortable in offering opinion on the skin or other matters, so I think she's already answered that question.
Yes, ma'am.
Thank you, Your Honor.
So sustained.
Anything
Sustained.
else on this witness? Ms. Fox?
No, ma'am.
Ms. Bernard?
No, Your Honor. Thank you for your time, Dr. Hutchison.
And with that announcement, that would conclude this Zoom appearance today. Thank you for joining us by Zoom today, Doctor.
Thank you, Your Honor. Have a good day.
You too.
All right. Now, we finished up Hutchison. We are going to move on to the next one, who I think is a nurse.
No, remember, we're going to do Dr. La Posada.
Right. I just remembered that. La Posada.
Because the nurse is short and it's really good. So I think saving her for the end would be awesome.
All right. That's what we'll do then. So we'll go to La Posada. Dr. Michael La Posada. Here he is. Let's make that embiggened. Okay. Here we go. I just want to point out this was day 8 of the trial. We are on day 21. We have dragged this 10-day trial out to 21 days.
Please tell the jury your name.
Oh no!
Yeah.
Not another Video deposition. I can't.
Look at that tie, though. Holy shit!
I know that's a
I like
Monet
it.
A loud tie.
I like it. It's very artistic. I bet he
making-
got that at the Art Institute in the gift shop.
It's making a statement.
It's like a Matisse.
Yes, I am Michael Laposa.
And how are you employed, sir?
I'm the professor of pathology and chairman of the department here at the University of Texas in Galveston.
So a hobbyist.
And what college and educational background has entitled you to obtain and maintain that position?
Oh,
After
I
completing my
remembered.
undergraduate degree
I
at
remembered.
Bucknell University.
I remembered what Nick's square was that we were supposed to add. No objection to the qualifications of by the prosecutor, but I didn't add it because I couldn't read my own notes. All right, I'm going to write better ones for tomorrow. No,
Although,
no,
wasn't it? Didn't you say it was no objection? And we
no
were
objection qualification, but I wasn't thinking
Oh.
witness.
To be
I didn't. I
fair-
should have written down witness. You know what?
Doesn't-
Now I can't add it because this is the last state. This is the last whatchamacallit, expert witness on the defense. So it's too late. Whatever. But I remembered.
Pennsylvania. I was an MD, PhD student at Johns
the
Hopkins.
ADHD right there kicking in.
I completed both degrees and then did a residency at Washington University in St. Louis before getting my first faculty position at the University of Pennsylvania in charge of bleeding and coagulation testing. And I began to see patients there. And then I moved to the Mass General where I was for 19 years and saw lots of patients, adults and children. One should not be confused by the term pathology. It's not all autopsies and biopsies. Some of us are regular medical consultants, and mine happens to be for patients who bleed and heart. Then I went to Vanderbilt for 7 years, and I've been here for 11.
Okay. And you're a medical doctor, are you board certified?
Yes.
And sort of certified in pathology?
Yes, clinical pathology. Those are the ones who see patients. Different
I
from
love that
anatomic
works with the
pathology.
living
we
is
do
one of
others.
his qualifications.
And do your patients include adults and
That
children?
is a new one I haven't
Yes,
heard
they do.
before.
And what training have you had post-medical school, specifically in the issue of bleeding, clotting, and blood disorders?
Yes, during my residency, after doing the basic rotations of blood bank and microbiology, I spent a year specializing in coagulation cases, saw patients with bleeding and clotting disorders, and that equipped me to start seeing patients and consulting on cases in my first job at the University of Pennsylvania for 4 years.
And have you received any special awards or recognition for your work in this field?
Yes, probably most relevant to this case is I was named the best of Boston doctor for 2 years. This is a very hard thing to do. There are 10,000 doctors in the Boston area, and they pick 200 to be featured in their magazine as the very best ones. Usually it's a result of patient care, meaning it's not for me reading a biopsy or doing anything else. It's because I took care of the cases that were referred to me. I also won a number of teaching awards. I was the best teacher at Harvard for 3 or 4 or 5 years, and I've won a few other awards, mentorship, things like that.
Golden Globe.
When did you teach at Harvard University?
I became the first director of their clinical laboratories in 1989 and was director of the coagulation laboratory, among others. And I stayed there until 2008.
Have you authored or written any books on the subject of bleeding and clotting?
Yes, I actually am the editor of what's called La Posada's Laboratory Medicine, which is used all over the world for laboratory testing for the instruction of medical students. And I've written other books, one called Standards of Care in Laboratory Medicine, and I've written the book on coagulation disorders for that, and
Move over, Steve Gasney. He wrote the book
the
on
books
it.
for 5 other diagnostic areas like microbiology and blood banking.
Are those books only written in English, or are they translated into other languages?
No, they actually have been translated. To my surprise, people have decided it should be in Turkish and Italian and others. So yes, it's for global use. We have students from other countries who do our residency, and interestingly, from where they are, they've used this book.
And do you have any approximation in terms of care of actual patients that you have dealt with in terms of bleeding disorders since you began your career?
Sure. So it turns out that many doctors need specialty help on making a diagnosis about why their patients are bleeding or why their patients have blood clots. Those are the two sides of coagulation: too much clotting and too much bleeding. So, in an effort to assist them, we set up a program starting at the Mass General, where every case of somebody who was evaluated for bleeding and clotting came through me, and I opined on the diagnosis. I started that in 1995, and that allowed me to be involved in the diagnosis of more than 50,000 cases. And I was referred patients that I saw directly, not just looking at their test results. And we had a practice that allowed me to see several patients a week for about maybe the 13 years I was there. I still do it, although most of the time now I take specialty referrals.
Your Honor, at this time I would tender Dr. Laposada as a clinical pathologist and ask that he be able to provide his
Any
opinion
objection?
in that field and as regards bleeding and clotting disorders of the blood.
Ms. Fox, any objection?
No, ma'am.
Ms.
Damn it, we could have had a square.
Then the doctor will be admitted as an expert in the field of clinical pathology as requested by Mr. Hood.
Doctor, in this case, have you had the occasion to become involved and consult with my office about a young man by the name of Jameson Timms?
I have.
And what have you done? What have you looked at? What have you reviewed in terms of consulting with us on his case?
I have it here in front of me. Most importantly, I looked at the pictures of his arms and legs and torso. And I have 5 or so pictures that are particularly relevant. I've got a laboratory test from Erlanger over periods of time. I have data from the mother, Carrie Timms, about her medical history. I have letters from another expert, and I have emails describing the case from you and from the mother.
So in my questioning, I want to focus specifically on your review of images and records that pertain directly to Jameson Timms. Fair enough?
Yes.
Okay. The photographs that you have referenced, what is it that what do they purport to show? What do you see on these photographs?
The big question is whether or not the mark.
Okay. Speak then.
Okay, wait, hey, doctor, just one moment. We lost you. We did have a freeze of the internet for just a moment. So I think I'm going to let Mr. Hood re-ask his question and then get you to respond again so we can be sure we didn't miss any of your answer. So Mr. Hood, if you'll re-ask your question.
Sure.
Thank you. Yes.
Doctor, as regards the photographs that you looked at, we lost you. You used the phrase "the big question," and then you froze.
Yeah. So the big question is whether or not these skin changes are bruises. And just to make sure everybody understands what a bruise is, it means that there's blood that has leaked out of the blood vessel and it has pooled under the skin. So that's the question, and it has a particular timing characteristic where the blood, which is red starts out as red because of hemoglobin, changes colors.
Hemoglobin.
We've all had bruises.
That's
so
a
we
fun
know
word.
They go from
That is a
purple
fun word.
And then ultimately to something lighter like green or yellow and disappear over a period of days.
And in that regard, the photos that you've been provided, what do you note about those photographs?
The most striking features of the observation are that the marks are on a mottled surface. So when you look at the skin of someone, and you could actually trace all the blood vessels with a crayon if you had to, those represent dilatations, that is expansions of a blood vessel. Imagine it as a pipe that can contract or get bigger. And the baby has mottled surface. See, you can tell that the blood flow is not normal. And then on top of this are some bright red marks, but they're not usual places for bruising. In a child that's walking, not this one, for example, you'd find bruises in certain places where a child might fall or hit themselves. In a child who's being cared for, there are bruises in certain places, but they don't follow the path of the bones. So the one picture, for example, shows this very clear pattern where the bright red marks go right along the edge of the kneecap. It just hits on the right leg, and on the left side of the kneecap, it just makes a circle around. And then it proceeds down below the kneecap, and it stays on top of the bone. And then there's another one that's on top of the bone. And when you look at some of the others, they're in the protrusion of the elbow. These are not places where you just get a typical bruise. Now, that's not to say that is there a possibility that there's abuse or somebody scraping along the edge of a bone, but boy, that's unlikely. And so that's a first clue, the mottled surface and the fact that these red marks, I won't call them bruises because they're not, but the red marks follow the pattern of the bones. So not something I've seen, and again, I've been doing this for a long time. There's something else going on here.
Did the photographs that you were sent show a time lapse as to when those marks appeared versus when they disappeared?
So I understand from commentary about the time course, and for these bright red marks to be bruises, they're not going away in a matter of hours, but that appears to be the case here. So now you have to wonder, what was it? So you can get bright red marks when the pipe bursts and the blood is there, right? You could also get bright red marks if the blood vessel just gets bigger. So you had clusters of blood vessels, and maybe there was some leaking around the blood vessel, but it really was not a bruise. This was just something that can happen because blood vessels are fragile. It turns out that the pipe, which is the blood vessel, is surrounded by something that makes it strong. And that strong element is called connective tissue. Collagen is one of the proteins that makes it strong. So obviously the question
So wait a
that
minute.
I would ask next is,
If you have a connective tissue disorder, then your vessels can just unexplainedly enlarge and get bruisey looking on the outside. Am I to understand that correctly?
Yeah, but
I think
Megan,
that's what he's saying.
what about the frenulum adjacent tear? and the impetigo.
What about the frenulum adjacent tear and the scratch on the face?
You know she's gonna ask.
What about the squunching?
And the squunching.
Oh.
All right, I think we can go ahead and check off states doctors are paste eaters. I've
Yes.
heard
Yeah.
enough from this man to convince me of that. States doctors are paste eaters. Damn.
Like, it's so funny how it's like, oh yeah, your body needs this and this and this, and if it's deficient in any of those things, it could go wrong. Apparently, unless you're a baby, in which case, it's fine. Everything's fine.
Right.
It's got a couple fractures and squunched, but it'll be fine.
And with a
Take them away from the
demonstrative.
parents.
Now, the state's experts, when asked a question they don't know,
Yeah, ceiling cats.
Well, I mean, that they are not real doctors. Now, the defense is experts. This was a genuinely interesting case. I wanted to look deeply into this, but, I did more research and I found this. Notice no ceiling cats, no
ceiling
affected,
cats.
Yeah.
JKD Buck says having him there is like having George Lucas there to explain Star Wars and Howard the Duck to you.
Bring back Howard the Duck. We need a part 2.
No, that was a dark time for America. No more Howard the Duck.
Here is, just looking at this child, is there a problem with the connective tissue?
Have you been involved throughout your career in the analysis and/or investigation of or review of traumatic bruises caused by intentional trauma?
Yes, I have.
Do these marks that you see from November of 2021 on Jameson Timms appear to you to be bruises caused by trauma?
Not at all. Totally unique.
Totally unique.
I mean, didn't make sense there.
Boom! You can check off boom roasted. No, they do not appear to be regular trauma bruises. They are totally unique. I can't believe I don't have a bingo yet.
I can't wait for
so
Miss
close.
Fox to say, but what if the baby was squunched? And because isn't the latest thing that Dr. Mercer gave us is that they held the baby very hard on his ribs, hard enough to break the bones, but not lead to bruising.
Squeezed, squeezed.
And then banged him on a counter like he was a jar of pickles and we're trying to get the lid off.
When will I learn not to take a drink when Mo is talking? She always has something coming afterwards that's worse than what she said before. That's going to make me spew.
It's my mutant power. I was hoping for storm powers and I'd get to control the weather. No, it turns out the ability to make people spit and choke on their drinks.
That's
only
going
fans page
on
would
the
get
bingo
more.
card. Mo makes Megan choke. That's going on there tomorrow. 10-yard penalty. Repeat third down.
Hike, baby.
Squinch. Hike.
When we are bruised, do the bruises last on the body, on the skin?
Yeah, so there's a lot of variability and it's hard to date a bruise. But surely it's on the order of days, multiple days. I think every juror and everybody in the courtroom who's had a bruise has noticed that, at the end of the day, somebody would say, oh, look at that, did you bruise yourself? And then you follow that bruise for the next 2 or 3 or 4 days. I see it on family members, how did you bump yourself? So it's usually something I can see in one color or another for 3 or 4 days.
And why do bruises, as they age, why do they turn colors?
Yes, because it turns out that pigment that gives the red color, hemoglobin, changes color into something that makes it blue. That's the purple. It's red and blue. And then that changes color again, which makes it a bit more yellow. So hemoglobin degrades chemically, and the hemoglobin comes out of the blood cells because they're under the skin and they're being broken apart.
Is that rule, for lack of a better phrase, different for babies than non-babies?
Well, not to my knowledge. I mean, I think the process is exactly the same. I can't imagine the biochemistry of hemoglobin oxidation changing from neonate to toddler to adult. So I don't think there's any evidence to support the fact that this would be different.
So if a child abuse specialist testified in this case or offered testimony in this case,
his face is
in her
exactly
opinion,
what we think of child abuse
bruises
specialists.
can
Right?
and do appear on infants and then resolve within 48 hours. Is that news to you?
Well, Yes, I mean, I have to say I'm an evidence-based physician. So there's 63,000 medical journals, and I read journals that talk about bleeding patients.
Your Honor, I'm going to object to anything from the journals. He's not allowed to do that. We're not allowed to do that.
Shut up!
We got your microphone turned up loud, Ms. Fox.
Shut up. Oh, I got a bingo.
Mr. Hood, what would you say to that objection?
I'll redirect it.
Okay, so let me just fill the witness in. So they're on direct examination, doctor, you can't testify about what a journal said. I'm going to let Mr. Hood re-ask his question. It's a different rule on cross-examination. I'm sure Ms. Fox and Ms. Bernard will have questions on cross in that regard. But Mr. Hood, if you'll go ahead and redirect your question.
Okay. Based upon your knowledge, your training,
she explains it
your
to the
personal
witnesses.
research and your experience,
Yeah.
Is there a different rule or process for the resolution of bruises in infants versus non-infants?
I have not had experience with something that would be different for a child of this age.
Okay. All right, doctor. That's all that I have for you right now. The other attorneys will have some questions for you, okay? Thank you.
Thank you, Mr. Hood. Ms. Fox, what questions do you have?
Good afternoon, Dr. Lopezada.
Yeah, wait, hold on.
I have a
Yes, Flux.
One thing I wanted to point out that I've noticed is that every time the fucking prosecutor objects, we can't do literature, she only has to object one time. Do you guys remember how many times the defense had to object to Miss Pop Brownie using literature?
Yes. Right, yes.
192 million.
And that crazy high lady didn't even write the book. This dude wrote, he's like, let me just look for my own chapter and verse.
Right? But it's like, she only has to say each witness, because she's doing it to like every fucking witness now. But she only has to do it once. Versus the prosecution's witness that were like, oh, you objected to that 6 million times before? Fuck you.
Yeah, exactly.
Like, to be fair, look, Vera Brown was just waiting for Dairy Queen to open like I was this Saturday. So it was a hard thing. She couldn't remember stuff.
I do not forgive her. I do not.
No.
Letter dated May the 3rd of 2022, purportedly signed by you with your opinion to Juvenile Court Judge Lori Moss. Is that the only time you wrote down your opinion in this case?
Yes.
Okay. So you never did an actual report for Mr. Hood?
Oh my God, I hate her.
Based on any current
Jody didn't even read the fucking report, ma'am. Like, do we want to talk about reports?
And in that particular report, you indicated that you were actually consulted by Carrie Timms to review the potential marks that the child had on him in November of 2021?
Yes.
Did you know that Jameson had had a successful outpatient circumcision with minimal bleeding?
She's obsessed with this.
Does not surprise you?
No.
Did you know that he actually healed very quickly?
I was gonna say she
quicker than
keeps it up a
expected
lot.
from that
Why
circumcision?
is she focused on his circumcision so much?
Yes.
Did you know in the medical records from Erlinger on page
I think it's the only
52
thing she can
that
point
the
to
nurse noted
that's
that
healing
he stopped
properly.
bleeding within 30 seconds of having his blood drawn?
That sounds fine too.
That sounds fine
Okay,
too.
can you pause it, Megan?
Yes.
Did you actually look at the platelet counts?
So here's what she's doing. Because he is a specialist in both coagulation, bleeding, and clotting disorders, what he was brought into this case was to discuss how these could have happened. And he said he's been, through his research, thinking it's a problem with the strength and the connective tissues that strengthen the blood vessels. So there would be no clotting issue for his circumcision. He doesn't have a clotting disorder. What he has is a connective tissue disorder. And I hate this bitch.
Amen.
Amen.
From the Erlinger
Hallelujah.
records.
You know, the platelet count
Get the
was up,
Tylenol.
I think it was about 600,000.
Well, the platelet count on the Erlinger
We need
record
that
I'm
as a
looking
bingo
at on
square
page
too. I
43
remember.
shows it was
Hallelujah.
449, which was in range.
You see it here.
Yeah, much lower than what you just said, but it's within the range of 15 to 40.
Oh, yes.
Did you note, or did you ever receive the Children's Hospital of Atlanta records that gave him, again, normal platelet counts of 411 and 285 respectively?
Yeah, the platelet count was not an issue.
Okay. Did you also look at the platelet volume that is on any of the records?
Mean platelet volume normal at 7.2 for the first one when the platelet count was 449.
Okay. That would also be, as a hematologist or someone looking at the blood, something to consider.
Sure.
Okay. Did you know, or were you ever told that his von Willebrand factor was also within range?
I didn't know that. I saw that it was pending, but again, I'm not surprised. I haven't argued that it's a clotting disorder.
Okay. Is it important to look at the prothrombin time? And I'm not sure. So,
Yes.
did you
Fork
know
on the
that that
fork,
was
ma'am.
also
You
within?
can't argue with an expert.
Wait, I missed it. I missed the big burn. What was I working? What was I missing on?
So
Here.
basically,
Hold on.
she's bringing all these things up, and he's like, "Look, ma'am, I have an argument as to why it's a clotting disorder," and she's like, "Whatever."
Like, ma'am, I can argue why you're wrong. I just gotta move past that.
It was pending, but again, I'm not surprised. I haven't argued that it's a clotting
Oh,
disorder.
yeah.
Okay. Is it important to look at the prothrombin time? And I'm not sure.
I need
Okay.
a fan that says
Did you
C
know
word.
that that was also within range?
Absolutely. This is
I
not
need
a
that
leading,
too.
I
disorder.
think they
It's a
have them
blood
on
vessel.
Amazon. Gonna look.
Did you look
Or
at
one
the
that says
factor S to
bullshit?
see that that was also in range?
Yep, factor 8's normal.
Okay. Were you told that the hematology came back normal from both Erlanger Hospital and Children's Hospital?
Yes, what's flowing through the blood is fine. It's the blood vessel that holds it that's the problem.
You have once said that we are underdiagnosing child abuse far more than we're diagnosing child abuse, haven't you?
I have.
You also said that you can't tell from looking at pictures of two children with bruises which one has a bleeding disorder and which one has child abuse based on the photos alone.
Absolutely.
Okay. Did you know that Jameson had no additional bruising incidences after he was removed from Carrie and Brady Timms' homes?
Oh, stop with
No,
this.
I don't know that story. Thank you for telling me.
Did you know that he had no additional broken bones after he was removed from their custody and care?
No, that's information for me. Thank you.
Okay. It would make a difference if you're saying someone has weak vessels holding that blood in, that it only happened in their care and it doesn't happen in anyone else's care, doesn't it?
It may be because in the care of one person, there is something, maybe the treatment with a medication, pain medication. I've seen people give aspirin or Tylenol to their children, and they have a modest bleeding problem or blood vessel problem, and then it gets worse. And then you move to a different place and they don't treat the child that way. So it doesn't necessarily get connected to abuse.
No further questions, Your Honor.
Thank you, Ms. Fox. Ms. Bernard, do you have questions of the witness?
I do, thank you, Your Honor. Good afternoon, Doctor.
Good afternoon.
So you were able to review the records from T.C. Thompson Erlanger Hospital from the November 2021 visit for Jameson, right?
Yes, I have them here.
Okay. And I believe the platelet count was noted on November 18th as 449 with a normal range of 130 to 400.
Yes.
So I know you mentioned that it's what's flowing through the vessel is fine, but does that elevated platelet count indicate anything to you or anything that might be relevant to determining what's going on with Jameson?
No, it turns out that many different disorders that we have, even viral illnesses and other things, raise the platelet count. This is a very modest elevation in the platelet count, so it really has no clinical significance.
Okay. How about the red blood cell count being on the low side, 3.06, when the range is indicated to be 3.1 to 5.8?
So there is a slight decrease in the amount of red cells in the body. If I were evaluating the patient, I might try to find out if all these are connected. But really the connection to the connective tissue may or may not have something to do with this. I don't know.
Okay. And so I have a few other questions about test results there. For white blood count, I believe the result for Jameson was 6.4, which was indicated to be low in a reference range of 7.0 to 12.9. Would that have any relevance to your determination?
No, if you're looking at blood counts, white blood cell counts that are below, and if you see them, and I've seen a lot of them that are really low, you're predisposed to infection. But those levels at 6.4, that's plenty adequate enough. I would be much more worried if you were down around 1 or 2 for predisposition to it.
Okay. How about hemoglobin being 10.2 when the reference range is 10.8 to 13.3, so also a little bit low?
Yes. So it could be that the bone marrow is a little compromised through this whole thing, because the white blood cells and the red blood cells are made in the bone marrow. So through whatever events were occurring, that looks like it is a reduction in, I'm guessing, the production of the blood cells. And this is something that you might follow and look at another time to see if it's still a problem. But again, those are plenty adequate. Values that would make you short of breath, because the red cells carry oxygen. So if there are not enough of them, you get short of breath, are far lower. The hematocrit, 28.6, you're talking values in the low teens that would make you symptomatic. So no, those, although they are low, are not concerning because they're not variable.
Well, thank you. You anticipated my next question about the hematocrit level as well. So then I'm going to ask you about the MCV and MCH results that were both indicated to be slightly high. Does that tell you anything that might help us understand what's going on with Jameson?
Not without further tests. The MCV tells you how big the red cell is. It's a biconcave disc, so what it means is instead of being, say, this big, it might be that big. Typically you'd worry about nutritional deficiencies of vitamin B12 and folate. Usually in an older person, there's really no dietary issues in this circumstance. And again, those values, though slightly out of the reference range, are not going to be problematic. I might add one other thing, and that is that even though you are at a children's hospital, the reference ranges for adults for a lot of these tests are the ones that they list. And without having a parallel column of reference ranges for adults, and then children at different ages have different levels. So somebody who's 2 months old might have a different reference range from somebody who's a year old. The trouble is it's hard to say what's normal because nobody wants to bring in their normal 2-month-old child and have 100 of them tested to find out the normal range. So we don't really know what the reference range is. So minor variations, especially for little kids like this, are really not an issue.
Thank you, doctor. And would the fact that Jameson was born premature have any potential impact on any of these findings or any of your conclusions regarding the blood vessel strength?
Well, that's a very good point, and I'm certainly glad you raised it. But some of the problems with prematurity show up after birth, of course. And some of those problems then resolve as you are older. So if you are a month and a half old, you might be somewhere in the cusp of whether or not you're in fetal maturity or whether or not you're brand new, newborn maturity. So when you start looking at somebody who's premature and has a pattern, especially a pattern that went away, then you start thinking about the impact of prematurity on the current condition, that is the one seen at a month and a half.
And while I'm asking you about test results that were slightly abnormal at the time, what about the albumin level that came in slightly low at 3.7?
Yes, so the main protein made in body is albumin, and it is made in the liver. So what I saw when I saw the albumin level is a value that was a little low, but then I looked at it, it says 3.7 with a reference range of 3.8 to 5.4. On another assay, here is January 13, 2022, I looked at the albumin again, and it was 3.3 and the reference range is 2.5 to 4.6. The liver is able to make protein.
How about lipase levels? Would that tell you anything that would be relevant to your determination of what's going on with the blood vessels?
So lipase is made in the pancreas, and usually we see elevations if the pancreas is damaged. So this value, and I'm looking at the value of 14, with a reference range of 8 to 78, yes, it might have been low, but what we're really looking for the lipase are elevations. Meaning if it's slightly low, it doesn't really matter, because it's a marker of injury. That is, it gets higher if you've been injured. So a value of 14, not concerning, even if the reference range started at 15. What I'm concerned about are the numbers above 70.
Okay, and how about the NEUT count?
Right. So those are specific white blood cells called neutrophils. And you need to have a balance of neutrophils and lymphocytes. And so this one is a little bit low, but the total white blood cell count in the testing from this date, November 18, 2020.
Folks, I just want to take a second to point out that I just gifted 5 memberships to the Fox Den. All 5 of you, Charlie, Frodo, Liz, Andrea, Ann, and Smoking Cats, got gifted memberships just for being here today, because I appreciate you. Now, don't forget to return the favor and hit that like button and the subscribe and share out that we're doing this trial, because it is really important. And if you want to go the extra step, if you want to send breadsticks, you want to support the show, you can do that with super chats just like this one. Rosella's Realm, thanks for the 5. I hit 2 good balls on the golf course the other day. They belonged to my lawyer. Oh, no. And we also have super tips for those of you who would like to use AI voices to send your super chats. We do have super tips. I have not opened them yet today, so I don't know if there's anything there, but let me take a look. Yes, Rosella's Realm. Oh, I have to change my screen. Hold on. There we go. Rosella's Realm sent one for 5. Thank you so much.
What is the difference between roast beef and pea soup?
Everyone can roast beef.
Why don't I get that? Why don't I understand that joke?
I guess it's dirty. I'm guessing beef could be a euphemism for any number of body accoutrement.
All right. I'm not going to ask too many questions. Rosella's Realm, thanks again for another 5.
What did Jabba the Hutt in a bikini and Tina wearing a corset have in common?
Nobody wants to see either one.
Well, unfortunately for you guys, if you are tuning into my show tonight, you will be forced to see at least one of those things, unless the breadsticks do flow. Because we were told, I've been told that some of the hate ecosystem, they think that they can make lots of breadsticks by showing their overabundant cleavage, shall we say. I have a theory, though, that the chat doesn't want to see it, and they will pay me not to. That's what I think.
That's how I work
pay you
my
not to.
fans. You know, $25 and you don't get to see what Gravity and 6 Kids does to boobs. I mean, it's your choice. You don't have to pay it, but it is a reverse hostage situation.
Exactly. And I hope you all enjoy your gifted memberships. Though, for those of you who did just get the memberships, I did a members only stream yesterday because it's soup season, and I made a loaded baked potato soup. It was delicious. It was the best cream soup I've ever made. Just saying. Also, I made a giant pot of it. I mean, like way too many potatoes. I think I put 15 Idaho potatoes in this thing because I have a lot of people in this house, you know, and I was like, but they're not going to eat it. We're going to have leftovers. Nope. I had a serving and a half left over.
Don't you hate
Damn!
that? I make giant pots of soup and I'm thinking I can eat off of this all week. I come back, there's like, I feel like Oliver Twist. I'm like, please, Sarah, can I have some more? I only cooked it.
It was really good, and I made Cowboy Ken's recipe. If you've ever watched Cowboy Ken on YouTube, he's really cool. He's like this old cowboy. He makes stuff, and he cooks outside. I love him too. I made his recipe, and he put sausage in it, like a smoked sausage. So I did that too. It was delicious, you guys. It was so good. The kids gobbled it up. My children hardly ever. I mean, they like what I cook, but I noticed that they don't usually go back for seconds, you know? I think they went back for thirds. And Hangry was like, Mom, I know it looks like I didn't eat a lot of this, but I'm so full. And I'm like, yeah, that's the potato. And there's so many potatoes that he probably ate 1.5 potatoes just in his one little bowl.
Nice.
Oh, so good. So anyway, if you want to watch me make that yesterday, that was fun. And it's on the members only.
Was 6.4 adequate. So collectively, the number of neutrophils and lymphocytes together seems fine. Would I follow it and do the next complete blood count? Sure, but that would be a routine evaluation. I wouldn't even bring the child in earlier to see how the neutrophils are doing.
Okay, and how about the sodium level? I know, again, you're talking to a bunch of lay people here, and we do hear about sodium and blood vessels and how you shouldn't eat too much sodium if you're worried about your heart. Are you concerned at all about the slightly low sodium level that was tested on Jameson?
So the answer is no. There's usually a pretty tight range for sodium, and so we pay attention to all the changes in sodium, and it's relevant if it's too low or too high. In this particular case, it is so close to normal that I don't know of any doctor would follow that up. And I noticed that in a routine evaluation in January, now a little bit later, it did come into the reference range. It was 136, and the reference range was 133 to 42.
Okay. So would it be correct to say that even though we've got some unusual or abnormal values, that none of them were at the point where you believe they were the cause of the unusual markings?
The only one is the genetic test.
And did you look at the genetic test with the
Yes.
variant on the collagen producing genes?
Yes, I have the report from the University of Washington.
Come on, I need unknown
Collagen
significance.
Diagnostic Laboratory, and I think it's highly relevant.
And why do you consider it highly relevant, doctor?
Let me explain that in your body, the part that gives you structure, it's like the girders of a building, are proteins. And imagine collagen as one of the girders of a building. It's a protein that is made, and this structural protein is also important in making the blood vessels strong, so that they don't dilate too much, they don't compress too much, they don't leak. So when you evaluate a patient for a picture like this, they did the right thing to look at this really prominent protein called collagen, which is important in wrapping around the blood vessel. And they found an alteration in one of the collagen genes, which means it would make a bad girder for the building. And so the way you classify the findings in genetics is if there are 2 or 3 reports where they say this mutation has been found and is associated with this disease, then they say, okay, then it's here. If the first observation appears, but not a second one, at the moment you're evaluating, it's called variant of unknown significance.
Unknown significance. He just brought it up. You can check off unknown significance. And I think that we need to add midichlorian count to the bingo.
Yeah,
I do.
card.
I'm going to ask my doctor about mine.
How's my midichlorian count? I really like a well-timed Star Wars reference. Thank you for that.
That was a good one.
That was a great one.
That was a
It was
good one.
Perfect timing. Was cork on a fork called? Yes. Let me go over what was called on the bingo card. So far, we've had shut up. What a bitch. Here, let me just show you my card. That's to make it easier. Shut up. What a bitch. Overruled. Double salute. Boom roasted. Objection. Brassy locks. Cahunty behavior. States doctors are paste eaters. Chat hates prosecutor. Cork on the fork. Unknown significance. Gets squunched. Everyone gets angry. Megan hits wrong button. Panel hates prosecutor. Rude. Flux gets angry. And sustained. That's where we're at. All right. All right.
Oh,
back to the midichlorians.
And what that means is that it will take some time. Some other scientist studies the collagen gene and finds out that this mutation on a certain part of the gene, and it's listed here what it is associated with disease. And I give you the example of cystic fibrosis, which in 1989, we thought it was one mutation, one change in the gene. And by now, we know 2,000 different mutations can cause cystic fibrosis. So
Wow.
the variance of unknown significance becomes significant over time. So the fact that you have a picture of blood vessels with connective tissue on the outside, something clearly wrong, mottled skin.
Oh,
changes
tit
in
talk.
these,
Yes.
in the
We need to add
red
tit
marks
talk
on-
since I brought up the anti-Hales tits. I don't know why I did that. Now I'm gonna have nightmares.
And on good TikTok, I was able to convince Mr. Mo that I needed new bras and got 5 at Victoria's Secret sale online for for $100. That's
a
basically
good deal. 5 for
and I'm
100?
getting the little boob insert things, so they look like they're still happy to be here instead
Like
of
the chicken? You
falling
mean like
down
the
to my
chicken
knee.
cutlets?
Yeah, the sticky boobs that you were
The
talking
boom. The Boombas. Yeah. Well, the
Yeah.
Boomba is for when you
Nice.
don't wear a bra, though. That's for when you are in something that can't have a bra, like with
Well,
weird shoulders.
to
I mean,
be
you
fair,
could
we
stick
will-
it in your
we-
bra. You
We will
can.
be trying that because I still don't believe in the sanctity that little sticky pads are going to keep these bazoombas up.
I know,
So-
but they work. I'm telling you. I also wear them in my bathing suit because I notice bathing suits don't come with decent support cups at
No.
all. Not
It's
for
always the shelf bra, and if you've got a smaller band size, then you take a deep breath in or stretch. You've got one still up here and the other one down.
right. No, so the Boomba works great inside a bathing suit, a bikini top or whatever too. So that's great. Sticky says sticky boobs. Wait, what?
They're little sticky cutlets that it pretends that your boobs all happy to be here and hello.
Yes, and still where
instead
they're
of,
supposed to be. Mm-hmm. And you can stick them inside shirts that have weird it sticks to your clothes, so you can basically stick them to the clothes where you want the boobs to be, and then pull your boobs into them, and they stay there. It's kind of amazing. It really is. It is. They do. The only thing that's a little uncomfortable about them is taking them off. I will admit that every time it has to pass the nipple, I'm like, is today the day? Is today the day it's gonna rip the skin off?
That
Like,
would be
is
something
today the day?
Because Megan, I would be here preemptively trying to figure out what I'm going to tell the ER doctor if it was today. Look, your doctorliness. I was trying to look smexy, but not like an e-thought on my stream. And how was I to know that you weren't supposed to use Gorilla Glue? I'm just like that lady with the hair.
How was I supposed to know? Oh Lord. Oh, so far though, the reviews are good so far. I have yet to rip off a nipple taking them off. So that's good news. That's the good news. Yes, we got Tit Talk now. Tit Talk is all on the board. You can scratch that off, chat.
Mo takes 2 for the team.
J. Katie says hoverboards for boobs. Yes.
Well,
Right.
when you said Boomba, I was imagining a Roomba with tits on top, and I was like, I'd buy that.
All right, you know what? We have to just look it up. Hold on. The chat has to know what we're talking about. And they have great ads, by the way. Absolutely great ads. I'm going to go to Instagram for this because that's
Megan,
where
for
I
an
saw
ad
the
you need to
ad.
see is Kim Kardashian's new Merkin bikini thong.
Oh my God, I saw them. How ridiculous. How
I
stupid
want
is
to
this?
buy all of them, but I know Mr. Mo would be so confused.
I want Boomba to sponsor me, but they're probably never
Yes.
gonna. Wait, we got to get to the girls with the big ones because that's the ones that you can't even believe it. You're like, how does this even work? Wait, why is that? Why are these like? Where are the good ads? She's too tiny for this to
doesn't
make
have
any.
boobs.
She doesn't
I was
have
gonna say
boobs.
she's barely got any boobs.
She's got no. We have to find Boomba. There we go. All right, she's got big ones. Let's see.
Does she have big ones, or
Sure.
is it just them being pushed up in?
No, she does, but
Okay,
they're
she's
kind of
got good-
You see, look, she
Yeah.
did one side. Look at how much higher the one side was from the other.
I'm so excited.
See the difference? It's a big
Gonna see my
difference.
boobs where they should be. It's amazing. It's like a
Yeah,
pre-Christmas miracle.
See, they're sticky and they go inside the dress. And it's perfect. They're perfect. They're really great. The only thing that I would say, they do tend to get a little I don't know, sweaty. Like that part, but you can't tell until you take them off. Then you take them off and you're like, ew. What is that?
Then you take them off, and you're also worried about tearing your nipple off as well.
True.
I will not.
Yeah,
be
it's a
filming my
boob job.
try-ons.
It's a boob job in a box, basically. And if you are a 36 double D, that's close to me, Jane. You need to get bigger than I did. Mine are a little on the small side, and I went with like the F because they tell you. So you got to go bigger than that. Go bigger than F. So go to what's after F? G. E F G. Yes.
I was like, yeah, what is after F?
What's after F? I think I should have gone with G. And they also have them in different shapes. So like if you want to do the shelf kind of bra, they have that shape, but they also have here's the different shapes. See the double trouble bundle. They should really sponsor me. I could sell the shit out of these.
I will join you on
You
that
could
sponsorship,
wrap it
Megan.
up with your super tits.
I know. I mean, look, I could sell the crap out of these. I'm telling you. Look at that. Look at the difference.
I know.
I mean, and I'm going to sell so many of these
is
today.
this-
You're all
is
going to
this-
go buy these, and I'm not going to get a penny from it.
I was gonna say, is this like ladies buying it, or is this dudes buying it for their ladies?
No, I think that the ladies are buying them. I mean, these are great for the clothes that you're trying to wear that aren't good for bras, like look at this top. What kind of a bra are you going to wear with this? Now, first of all, you wouldn't catch me in this top. But if you are going to wear this top, but you can't wear a bra with it. But look how much better it looks with the Boomba. I'm not saying I would wear, but you might wear a bathing suit like that. Do you think they were fake? Look at this one. Look at the difference. Look.
That's how I
This is
feel
the
every
advertising
day.
I want to see.
Yes. Look at that.
This is the real difference right here.
Please, Boomba,
That is
hire me. I would
awesome.
be a significantly more startling before and after.
I'm telling you, this thing is a miracle product. Oh, look at the size of that one. See, that's the one I need. The one on her other hand, the big one. I need to get the big. Oh my God, you guys, I got sucked down a Boomba hole the other day. And I watched like all of these ads. Look at this one. Look at the difference. It's pretty amazing. Pretty amazing. Look, these ads sold me. No joke. I was like, $50, take it. Take my money.
To be
That's how
fair,
much they
Megan
are.
sold me after I found out it wasn't a Roomba with boobs on top.
I could sell these, but no one wants to sponsor me. I don't know. Like, no, I guess I'm just not important enough for a sponsor. The only sponsorships that are ever offered to me are like weird Chinese products that I would never use. The ones that I do use, I'm just not important enough for them. So whatever. See, Aspen Fallen just said, didn't know I needed these, but now I do. Yeah, no, you do. You totally need them. I'm sure they ship to Australia. They probably ship to the UK. Yes,
Or is that still
squirrel.
TikTok?
We can. I think we can mark squirrel. Yes, squirrel. I almost have double bingo now. All right, sorry, Dr. La Posada. We're getting back.
JKD Buck, the paper mache boobs for a Roomba are already being made right now.
Wait, Nana, you said Walmart has them? Do they? I don't know, but they come in a really cool box. I'll show you the box in a little bit.
Tits in a
box.
box.
Is cool. Ticks in a box, yeah.
And you have an alteration in collagen. All of those puzzle pieces fit together. And the fact that this might have matured, that there might be some compensation, there is that for many disorders, that you grow out of it, right? Von Willebrand's disease is a disorder you grow out of it. So you can grow out of things like this.
All right, I'm sorry. I need to apologize to the 20% of male listeners here. I may have just gotten them all in serious trouble with their wives. Can we get back to the trial, please? My wife just asked what I was watching. All right, to the wives out there, please put me on speakerphone or whatever so that your wife can hear me. I apologize deeply. Sometimes I forget there are men in this audience because there's only, God bless them, there are only 20% of them. And we sometimes talk about boobs and periods and they get so uncomfortable and then they get in trouble at work, at home. It's a whole thing that I never intend to do. So we shall stop that now, and we will get back to regular programming.
Megan, Jonathan's at work, and I texted him. I was like, don't try and put on the live right now, because sometimes he'll put his phone up and just have it play. I'm like, don't put it
Not
on
right now.
Please.
But anyway, show your wife, though. If your wife wanted to know what you're listening to, show her the Boomba. She's gonna want one. You should just get your wallet out. Get your wallet out, hand her your credit card, and say, "Go ahead and get one."
Yeah,
because
to be fair,
they need them.
Win-win
Mr.
for
Mo
everybody.
asked me on Monday what we did. All I could say was nipple soup. Because that was the only thing I remembered. I was just like, this guy made nipple soup. And he's like, do what now? This was on your trial? I was like, no, it was on a food thing that we watched when we were squirreling out. But
squirreling? Oh my God.
Maturity is classic. So this can all be associated with that. And there are different kinds of collagen. And the other kinds may have compensated for what was problematic in a month and a half.
Thank you very much, doctor. And I have one more question about a test that was done at Children's Hospital in January of 2022, where they attempted a reptilase and thrombin time, but the samples clotted prior to arrival. I've been waiting to get to ask you, the clotting expert, about whether that has any relevance or significance, whether perhaps we should have gotten those thrombin and reptilase levels retested, or whether there is any concerning information there that has any bearing on your diagnosis or analysis.
Yes, so let me explain the clotted samples. So when you have to do tests to look at clotting, the clotting can occur in the tube. You have to keep it so it's not clotted in the tube, so when you can take it out of the tube and put it into a machine to do testing, it's liquid. So to make it so it's not clotted, there's a little bit of blood thinner in the bottom of the collection tube. You put them in there, but you have to mix it right away. And so there are a lot of things that can go wrong, where if you don't mix in that little bit of blood thinner in the bottom, in the tube upside down, you can end up with some clotting in the tube, and then you can't do the test. Now, if I were to look at the child now, I would do it really from scratch. How old is the child right now? What are the clinical problems? And I wouldn't be over aggressive. I would try to explain what happened before with the understanding that whatever happened then might not be in play
Poor
now.
Flux is so,
Because that's true
she's so
for a lot of
sick.
things, especially take infectious
I got the
diseases.
blanket now.
When
I'm
you're
good.
sick with
If I
COVID,
fall asleep,
you're not
though,
the same
oops.
as you are when you're better.
Don't worry
So
about
blood
it.
tests are going to look different. So if things look like they're resolved, I would do regular evaluations. All that said, I would do whatever I could to find out as much as I could to explain the events at the time that these skin changes occurred.
And if another medical provider had testified, well, it doesn't matter that the samples clotted, we didn't need them anyway, would you consider that best practices?
Well, of course not. I mean, what that implies to me is it's a bias. So if you've made up your mind already that it's child abuse, then you don't need any tests. You look at the child, that was the point that I made that was quoted earlier. You look at two kids, you can't tell which one has a bleeding disorder and which one was abused. You have to do evaluations. You have to understand the whole picture. So, no, I mean, obviously it would have been relevant. The only reason it wouldn't have been is if you decided this is child abuse before you went any further.
Thank you very much,
Yeah.
Doctor. And on
Mic drop,
that subject,
witness.
so you have reviewed cases of
Mic drop witness. We can go ahead and
Yes.
check that off. Yep. Oh, I don't have it on my card. Oh, well, I can't get greedy. I almost have double bingo. Mic drop witness. Now, that was really
What
something.
do you do here to get double bingo?
child abuse and offered diagnoses that suggest that inflicted trauma was an issue. Am I right?
Yes, I've reviewed probably 300. I do it pro bono. I learned in the first case that people have to pay the attorney, so I don't want
Another pro bono witness. Wow.
There's an underlying bleeding disorder. So we do it for free. I usually
Damn.
have a team of people I consult because I don't ever want to be wrong and I want everything to be evidence-based. So I run it by people and say, does this look right to you in a conference? So we take the same level of being meticulous for a child abuse case, which is often just boom, decided early by a pediatrician. And even though I can look at it and say, boom, it looks like von Willebrand's, I don't want to say that. I want other people to tell me they agree. So this is as important as a cancer diagnosis or anything else. So we are meticulous about it, and we see it as part of our mission of taking care of sick patients, and that's why we don't charge it.
Well, thank you very much, Doctor. And my final question will be, based on your review of the medical records, photographs, and other materials that you have seen on Jameson Timms, do you see evidence of child abuse medically?
No.
Thank you very much, Doctor.
Nice.
Thank you, Ms. Bernard. Mr. Hood, do you have any additional questions of this witness? Ms. Fox, do you have any additional questions of this witness?
I did, just a couple. You were consulting strictly on the presentation in November of 2021, weren't you, Doctor?
Well, I
Call her a
had
dumbass.
And I believe I quoted some from
Carrie's
later
here.
dates that I'm looking for the date of the genetic testing, but I did have data, lab data from 1/13/22, and this is from Atlanta.
I think my question is that you were trying to give an analysis of the appearance of the photos that you were given from November.
Oh, that's true. I mean,
Yes, you are not making an opinion as to whether or not the 3 broken ribs were child abuse, or whether the compression fracture was child abuse, or whether the cut under the tongue was child abuse. You're looking strictly at the bleeding in November.
And Your Honor, I will.
Wait just a minute, doctor, just a minute. I've got an objection here. Ms. Bernard, what's the objection?
Your Honor, I will interpose an objection as to the characterization by the prosecution of matters that have already been disputed by other experts. So to the extent she is attempting to present them to this witness as facts that have been concluded, that is precisely why we are consulting numerous experts to determine whether or not there was a compression fracture and whether or not there was a cut under the tongue, since the child abuse pediatrician failed to document or photograph the alleged cut.
Okay. Ms. Fox, your response to that objection?
Your Honor, I have him on cross-examination. He was asked by the defense whether he thought there was child abuse in this, and he said no. And I am trying to clarify that he's not making an opinion as to the 3 broken ribs, or as to a compression fracture, or as to a cut under the tongue.
So I'll let you re-ask your question. Perhaps that's kind of a compound question, so let's break it down. So I'll let you ask it accordingly.
Dr. La Posada, you are not making an opinion as to the 3 broken ribs, are you?
No, I took all the information into account.
Okay.
I'm just not commenting on cause of or how these changes occurred. But I was well aware of those changes.
And you are not making a comment one way or another as to the cut under the tongue?
Yes, the frenulum dot, same picture as I saw on the skin, so it didn't cause me to think any different.
Okay. And you're not making a comment one way or another as to the, I will call it for purposes of this question, the alleged compression fracture?
I'm not making a comment about that, only to say that I'm aware that it was in the notes.
Were you aware that as to the variable of unknown significance in the qual 1A2, that a number of experts have testified that it was not likely to be clinical in this particular setting?
And Your Honor, I will interpose another objection.
Wait. Okay, what's the objection?
And we have had numerous geneticists, we have had 2 geneticists testify. The only person who said there was no way it would become pathogenic was a pediatrician with no genetics training whatsoever. So again, I object to the mischaracterization in the state's question.
Your Honor, I disagree. They call Dr. Pauls, who is the expert that puts it into the actual database, and he said that it is not the cause of the OI or anything in this case, that it was a big nothing burger, and we have wasted a whole month talking about it.
Nothing burger! You can check off nothing burger. She actually said it. I can't believe she said nothing burger.
Yes,
wow.
I've been waiting for it.
Holy fuck!
She must have been watching CNN that day.
Do you remember how she tried to tell the judge how she tendered in Dr. Brown when Mesner was coming in? She's trying to do that again. She's like, hey, Dr. Powell said this, as if the rest of us weren't all here.
Yeah, we were there. And why are you calling the defense's experts the expert that you're relying on? If you're calling as the state, if you were referring to the defense's expert as the expert in the room, well, then this case is over, ma'am.
This case is over.
You lost.
They call Dr. Pauls, who is the expert that puts it into the actual database, and he said that it is not the cause of the OI or anything in this case, that it was a big nothing burger, and we have wasted a whole month talking about it.
Oh my gosh, a whole month.
Ms. Bernard, I would strenuously disagree with the state's characterization of Dr. Paul's testimony as the genetic variant on the collagen-producing gene being a big nothing burger. He used the precise same analogy that this expert has used regarding collagen and its role in steel girders.
Yes,
and
he
the
did.
variant of unknown significance that we do not know whether it could be pathogenic, but it has certainly not been found to be benign.
Okay, so I'm going to sustain that objection.
Thank
I
you, Your Honor.
I don't, as to Dr. Powell's or Paul's, I'm going to sustain that objection. I'll let you ask your question to this witness.
Thank you.
All right. I think we can call Thug Judge at this point.
Yes.
She's not having any of this shit.
I understand. You're moving for a mistrial when you got additional time and you can call the same witnesses to address whatever issues. Is that what you're saying?
Yes, Your Honor. Because
Can we go to exhibits, please?
Judge can now be taken. God, I miss Judge Carroll. I love playing that because he's so great. I love him. Is that what you're saying? Is that what you're saying? Yeah, denied. I love.
That's a good one.
Let me get to the exhibits. Yeah.
I love his face the whole time.
Yeah.
He just
He's making the best faces when they're asking him stupid questions. He's like, it's amazing.
How often has a expert heard nothing burger in court? Like, it's so weird. And you guys, I wish so bad that you could see, because Catherine was sitting in the witness stand, you know? And I remember her she's so proper. So she's like sitting up and proper, and she's like, I don't recall Dr. Paul saying this is a big nothing burger. It's just the way she said it was so awesome.
But her face when she first heard her say nothing burger, she went from being like listening to like, and she looks at the jury like, I don't remember that. Do you
Sharon
remember
Fox
that?
said we wasted an entire month just based off of Dr. Paul's. Did you hear her? She's like, we wasted an entire month on this trial listening to that. Paul's only testified for a day. What is she talking about?
She means that she had to read, like Jody, reading more than 500 pages without little arrows is very hard for her.
The nothing burger. I love it.
You indicated, I'll rephrase it a little bit, Your Honor. You indicated that it was a variable of unknown significance, correct?
Yes.
And the report itself says it's likely not to be affected clinically, doesn't it?
Yes, it says that and more.
Okay. And then my next question would be, experts in this court have testified that it did not affect this particular child. Would you agree or disagree with that statement?
I actually think it probably did, because all the other findings are consistent with a defect in connective tissue.
Okay. In this particular situation, would it surprise you that he has not been diagnosed with osteogenesis imperfecta by either of his geneticists?
It's not. There's so many different disorders of connective tissue. Not having osteogenesis imperfecta doesn't rule out the other hundreds to thousands of disorders associated with bone or connective tissue.
Would it surprise you that the two geneticists who've actually seen Jameson didn't diagnose him with anything?
No, I'm seeing a child doesn't.
Because the state's doctors are paste eaters. So no. I am not surprised they didn't find anything.
That's false. That's false, because Dr. Krishnamurthy, I have the report saying that he is currently being treated for a connective tissue disorder.
But she was your doctor, right?
Yes. So I guess
I think she means she's talking about the geneticists
that had the Katie Porter hair.
Isn't she?
helmet.
Is she just talking about the state's geneticists, or is she also including?
She said
Krishnamurthy?
either. She says either.
Oh, okay. Well, then she's lying. State lies.
She's the nothing burger. She's the nothing burger.
I don't think we have state lies on this bingo card. I should have.
Look at the genes. So I can tell you just what somebody else says about genetics, even if they looked at it, because the answer is in the genetic test result.
And is it also true that a lot of variable of unknown significances actually turn out to be benign and are not causing diseases ever?
Sure, if there were no other findings associated with connective tissue problems, I probably would have relied on this as probably being less important. But in the presence of the pictures and the changes and skin changes and prematurity, I mean, it all fits in that story.
But you do think it's highly relevant that he hasn't had this condition with any other caregiver?
I've certainly seen plenty of cases where things changed over time. This is no place to reiterate every one of those examples. But yes, there are plenty of explanations why something happens at a certain point in time and doesn't happen after that.
Thank you, Doctor.
They're benign.
Yeah, dumbass.
Bitch slap.
Anything else, Ms. Fox? Mr. Hood, anything else of this witness? Ms. Bernard, anything else of this witness?
Have any of the questions you have just been asked changed anything about the assessment you made regarding the likelihood of Jameson Timms being a victim of inflicted child abuse?
I think it's extremely unlikely to the point of being almost an impossible explanation. It's a challenging world for a pediatrician who wants to do a great job and not miss cases. And 19 out of 20 children who have these marks actually are beaten. So our goal is to find the one that's not. And when that happens, that's when we step up and do the work for free.
Thank you very much, Doctor.
Nice.
Anything else of this witness? Ms. Fox? Ms. Bernard?
No, Your Honor. Thank you, Doctor.
All right. We can go ahead and check off. What did I just say here? Making shit up. Because that thing about the nothing burger was totally making shit up. That gives me double bingo. And no Werther's break today. Unbelievable. She didn't have a Werther's not even once. And I think we can check off damn. Also, we got 3. I got a triple bingo. And I think that gives some of you in the chat bingo as well. So that's going to wrap up today's episode of day 21 of the Timms trial. Poor Flux needs to go to bed immediately.
Yes.
You need to get thee to a bed.
I'm going to take a nap.
Yeah, you need to go nap. You're looking very tired. So you go and do that. And are you going to be streaming or no? You're going to be sleeping.
I'm going to take a nap.
But Mo in the deep end, you're going to be streaming, I'm sure. What's coming up for you next?
Let's see. Tomorrow I will have Mornings with Mo, and then this Saturday at noon, I'm breaking out the Donna wig, and we are going to go.
Oh boy.
Mo is going to be, roasting Donna Sue Adelson's sentencing as Donna Sue, who is now stuck in God's asshole Tallahassee forever.
And she missed dinner with a friend. So that was very disappointing for her. And Carrie, what are you doing this weekend? How you guys what's up for you next? Are you going to be with us tomorrow?
Tomorrow is Thursday. What time are we starting tomorrow?
10:30. I think we'll keep it at the same time. Around 10:30.
It just depends. I was able to jump on because someone's preschool didn't have water today for some reason this morning. So he went to work with me until he couldn't work with me anymore.
Oh no. Oh
So-
no. Okay, well that makes sense.
Yep.
Well, we are going to do the nurse tomorrow. So the nurse character witness will be tomorrow. Plus we'll probably start closing arguments because that's what's coming next. We only have one witness left and then we get to closing arguments. I am assuming that Friday we will be doing the verdict and wrapping up. So I'm hopeful that we will have river dancing, at least some of it done by then. Jennifer, send your footage in. I'll see if Rosalind can get that put together for us so that we'll have it by Friday.
I didn't do the green screen. Do I have to do that?
No, you don't. Okay. That's just for
Jeb
Mo.
actually created and already did the slow-mo, so I can send that to you. And then if
All right,
you
great.
need to do something.
Oh, just it.
Jeb just did it for us. So yeah, I'll send it into you here in just a minute.
Okay, cool. We'll
Hey,
get that
I
put
sent a link
together.
in our chat if people want to go to Liberty Policy Alliance, because you're always bragging about you are the power. Some things have been nominated through them. If people want to go vote, Spike was nominated. I was nominated.
Oh, cool.
And then our law that we got passed here, Ridge's law, was nominated. So if people are interested in voting, that would be awesome.
I dropped it in the chat. I don't know if that link worked where I put it. Let me know if that worked or not. If not, I'll figure out a way to get it in the, how long is the vote open?
I think until the end of the month.
All right, great. If not, I'll figure out how to get it in the description of the video, especially for tomorrow as well. So get over there and also join youarethepower.net. Awesome organization that helps bring attention to this. Oh, good. It worked. All right. Terrific. Helps bring attention to these cases. And we'll see ya. We'll see you tomorrow. Bye, everybody.
What the fuck?